turn her about 45 degrees, right? So if this is 45 degrees, or this is 90 degrees, right? Straight up and down, 45 is going to be half of that. So we're looking to get our hand 45 degrees. Now, if you work in a clinic or a hospital that has money, they will most likely have a positioning sponge for you. Okay? It is going to be a radiolucent, soft pad, kind of like the one we had earlier that was sitting up there during the summer, where you can just rest the hand on it and that gives you exactly 45. Okay, however, if you do not have such a pad, you will need to position it yourself and have the patient hold it there themselves, okay? Notice that Sharon is doing a very good job keeping the fingers straight. Okay, so when you are doing this, right, these fingers should be straight. Okay, so this would be an oblique of the 5th digit. If we're going to do the 4th digit, slide this over. Okay, it would be just like this. See, it's still straight. We're not letting the fingertip touch the board. Keep the fingertip nice and straight. Right? Third digit, same thing. Center there on the PIP, slide back slightly. Good. Okay, digit is straight. The reason is because we want to keep this joint space open. If you let it, the finger angle itself, you're going to close the joint space on the image. You won't be able to see the joint between our proximal and our middle phalange. Okay? Now, with the 2nd digit, okay, nice and straight, other fingers out of the way. So while we can do this for our oblique, you will notice that we now have a significant amount of OID, correct? So an alternative, which can be used for the 2nd finger, is actually the internal rotation. Oh, Sharon, I'm going to have you turn the other way. Good. And so, come down, move these fingers out of the way. Tuck the thumb. Tuck your thumb. Good. All right. And turn up 45. Try and keep this arm straight, elbow straight. Good stuff. I'm asking you to do a lot of things at one time. Okay. All right. So again, we're going to just slightly lift your finger because of that thing. Good. So this is going to be an internal oblique for the 2nd digit. As you can see, we now have much less OID, right? It's just very awkward for the patient to do sometimes. Okay, so which one you do is going to be up to your judgment.